Hello everyone, my name is Dr. Steve, and I want to welcome you to Dr. Mike Fertility Clinic for Men and Women. Today we would be looking at the topic fibroid. Join me as we delve into this topic to unravel the mystery behind it. I hope at the end of this discussion, you would be enlightened and solutions would be found as regarding this topic.
Good morning, sir. I went to your office, but your secretary said you were at the conference room.
Yes, that is true. We just ended a talk session with other doctors. So tell me, how may I help you?
You promised to enlighten me on the topic fibroid. I would be glad to know more about it.
Oh, that is true. I am about to go for lunch. I am sure we can talk about it during lunch. Let me start by saying what fibroid is. Fibroids, in the uterus, are tumors. They develop in, or on the walls of the uterus. They are common, and not typically cancerous. Fibroids are the most common non-cancerous, or benign, tumors in people of childbearing age. They are also known as leiomyomas, and myomas. Many people have fibroids with no symptoms, whereas others experience pain, bleeding, or both.
So, what is fibroid in simple terms?
Fibroids are growths, in, or on the walls of the uterus. They consist of smooth muscle cells and connective tissue. A person may have one, or multiple fibroids. They can be as small as an apple seed, or as big as a grapefruit. Or sometimes, even larger than that. They can also shrink, or grow over time. Fibroids are more common from age 30, to the age at which menopause begins. They usually shrink after menopause. Between 20% and 80% trusted source of females develop fibroids by the age of 50. When a fibroid is cancerous, it is called a leiomyosarcoma. Having pre-existing fibroids do not increase the risk of developing a leiomyosarcoma.
So, what are the type of fibroids?
Classification of a fibroid depends on its location in the uterus. The three main types of fibroid are: 1. Subserosal fibroids. These are the most common type. They grow on the outside of the uterus. 2. Intramural fibroids. These grow inside the muscular wall of the uterus. 3. Submucosal fibroids. These grow into the open space inside the uterus. Some fibroids can become pedunculated fibroids, which means that the fibroid has a stalk that attaches to the uterus. Fibroids do not cause any noticeable symptoms. However, some can cause significant discomfort. The symptoms of fibroids can include heavy periods, also known as menorrhagia, which can lead to anemia, painful periods, lower backache, or leg pain, constipation, discomfort, or a feeling of fullness in the lower abdomen, especially in the case of large fibroids. Frequent urination, pain during sexual activity, also known as dyspareunia. Some people may have fertility problems associated with fibroids. Fibroids may cause problems during pregnancy and labor, and they increase the chance of needing a cesarean delivery. Some sources suggest that removing fibroids can improve the rates of conception and live births, though there has been some controversy around this. More research is necessary. If fibroids are large, there may also be weight gain and swelling in the lower abdomen.
So, what are the causes of this tumor called fibroid?
It remains unclear exactly what causes fibroids. Their development may be linked with a person's estrogen levels. During a person's reproductive years, estrogen and progesterone levels are higher. When estrogen levels are high, especially during pregnancy, fibroids tend to swell. Low estrogen levels are associated with the shrinkage of fibroids. This can occur during and after menopause. It can also occur when taking certain medications, such as gonadotropin-releasing hormone (GnRH) agonists or antagonists. Genetic factors may also affect the development of fibroids. For example, having a close relative with fibroids is associated with an increased risk of developing them oneself. There is also evidence, trusted source, to suggest that red meat, alcohol, and caffeine are associated with an increased risk of fibroids. An increased intake of fruit and vegetables may be linked with a reduced risk. Overweight and obesity are associated with an increased risk of fibroids. Childbearing is associated with a lower risk of developing fibroids. The risk reduces each time the person gives birth. The following diagnostic tests can help a doctor detect fibroids and rule out other conditions. 1. Ultrasound scans. A doctor can create ultrasound images by scanning over the abdomen, or by inserting a small ultrasound probe into the vagina. Both approaches may be necessary to detect fibroids. 2. MRI scans. An MRI scan can determine the size and number of fibroids. 3. Hysteroscopy. During a hysteroscopy, a doctor will use a small device with a camera attached to the end to examine the inside of the uterus. They will insert the device through the vagina and into the uterus via the cervix. If necessary, they may also take a tissue sample, known as a biopsy, to look for cancer cells. 4. Laparoscopy. A doctor might also perform a laparoscopy. They will insert a small, lighted tube into a small incision in the abdomen to examine the outside of the uterus and its surrounding structures. If necessary, they might also take a biopsy. As fibroids often do not cause symptoms, a person may not know that they have fibroids until they undergo routine pelvic examination.
Wow, I have learned a lot already. If I may ask, are there any possible treatments to this? Please tell me.
Sure. There are a lot of treatments a person with fibroid can undergo. But the best treatment is to watch out for the kind of lifestyle you have or live. Maintaining a moderate weight, by getting regular exercise, and eating a healthful diet, may help moderate estrogen levels, which may help reduce fibroids. Also know that Dr. Meg Fertility Clinic for Men and Women have natural drugs and supplements, made from natural sources which are very effective to treating fibroids.
Tell me more about this natural drugs and supplements.
They are made from nature. They include fruits, leaves, stem of trees and others. They are very reliable, and they do not have any side effect.
This is great. I wish there are a lot of persons listening to you right now.
To get more information on any health-related topic or issue bothering you, you can contact Dr. Meg Fertility Clinic for Men and Women on 08060238034. You can also visit our Facebook page at Dr. Meg Fertility Clinic for Men and Women. Also subscribe, like and share our YouTube channel at Dr. Meg Fertility Clinic for Men and Women. Send us an email to gracewardom@gmail.com.
This is simply amazing. I really enjoyed this discussion. I think we should get back to the office. I can't wait to share this information with others. Thanks once again, Dr. Steve.
You are always welcome, Mrs. Jane.